How's it going, guys? I'm here with my beautiful wife, Vanessa, and I'm going to be teaching you guys how to do treatments on your spouse, your friend, whoever has a headache. And I do this somewhat frequently with Vanessa. She gets headaches. How often?
Probably once every other week.
Okay, so there's a variety of different stretches that you can do that are really helpful, and you find some good relief with them.
I do, like pretty immediate relief, and then yeah, it kind of lasts for then on out.
Cool. All right, so there's going to be three different techniques that I'm going to walk you guys through. Now, it's important to keep in mind where these headaches come from. The majority of headaches that I see that come through our office are called cervicogenic headaches. So what that means is different muscles throughout your neck and joints throughout your neck cause this pain to radiate up into your head. The most common type of pain to radiate up into your head is called the ram's horn. What that means and what it looks like is pain that originates from here and then wraps around your head. So a lot of people will get pain that just wraps up around one side. Sometimes people will feel on both sides, up around their temples, or even deep into their eyes. So to get rid of that ram's horn headache or that cervicogenic headache, we do a couple different things. We loosen up these joints in the neck, and we loosen up these muscles throughout the neck. So the first go-to is always releasing the suboccipitals. So what I'm going to do is I'm going to have you turn facing that way. And the suboccipital muscles are these muscles that sit right back and through here. And actually, if you don't mind turning even a little bit further. So what we're looking at here is these muscles right below the skull. And what we're going to do is we're going to release those by putting some pressure through them. Now, so if you go up to your friend, your spouse, whoever you're working on, and you run your fingers right underneath your skull, you're going to notice that it's kind of like that skull just disappears, and that's right where you want to be. Now, where we want to be, besides just below that skull, is if we go right down the middle and then all the way to that ear. If you go right in the middle of both of those points, you're going to be right on the money. So when you push on this area, it does not feel great. You're going to be pushing up towards their opposite eye. So if she's got a headache on the left side, what I'm going to be doing is I'm going to be applying pressure right in that midpoint, right underneath the skull, between the middle of her skull and that ear, and I'm going to be pushing up towards that opposite eye. So I'm going to bring her head back, and I'm going to use my thumb like this, and I'm going to be pushing up that way. Now, Vanessa, what do you feel when I push up in that direction?
Um, Obviously pressure right where you're pushing, but also a little bit kind of up through here.
Yeah, it's very common that will reproduce that headache. So once again, it's kind of hard because she's got a ton of hair here, but I'm pushing right through there, and I'm pushing towards that opposite eye, and I'm giving a good amount of pressure. I hold that there for just a second or two, and I keep oscillating back and forth, and I do that about 15 to 20 times. Then I relax, and then I reassess her headache, and I see how it's improved. And if it's improving, I keep going. Now, I always like to ask my patients before I even start, hey, what's your pain in your head on a scale of 0 to 10? And they will give me a number, and then I'll do this treatment, and then I reassess. And if their pain's going down, I know I'm doing the right stuff. Now, for the next part of the treatment, I'm going to have you flip around here, face towards the camera. So we've done the suboccipital release. Now what we're going to do is we're going to focus on loosening up these upper traps. So these upper traps are also a big culprit in causing these headaches. And so the upper trap, the first rib, everything sits right up and through here, and I really like to release it this way. So what I'm going to do is I'm going to take the wide part of my hand, and I'm going to place it right over the top of her shoulder, not next to her neck or on top of the outside part of her shoulder, but right in the middle. And I'm going to push down towards the floor. Once again, this does not feel good. Whenever you're doing this with these different muscle groups, what's going to happen is it can really irritate that tissue for a very short period of time. So if you're doing this and they start feeling their headache more, you're on the money. So we're going to take that webbed part of your hand, and you're going to push right through that upper trap. And you can tell by Vanessa's face, she's looking really forward to this. And I'm just pushing down like that. And what we're doing is we're trying to mobilize that first rib and loosen up that upper trap. So if I want to take it to the next level, I'm going to keep that pressure down, and then I'm going to pull her head over. And I'm going to keep going back and forth. I'm exaggerating the movement with my body so you guys can see what I'm doing. And that does a great job of loosening up that upper trap and that rib, which ultimately will take away that headache. So I'll do that about 20 to 30 times, then I'll reassess the headache and see how she's improving. If she is, I'll keep going until there's no more improvement or her pain's completely gone. The third thing that I'm going to do with my beautiful wife is I'm going to do a suboccipital release, and this doesn't hurt. This is actually really relaxing. So what you do is you're going to have them lie down on your back. I want your head right off the edge of this table here. Let's see if we can get this in the camera. And what you're going to do is you're going to cup their head with the web space of your hand. And you're just going to literally pull their head, put a little bit of traction on it, just like this. Let me show you here. Let me tilt this down. You're going to cup the bottom of their head so it's nice and supported. I'm going to bring my other hand on top, and then I'm just going to pull back towards me. That feels pretty good, doesn't it?
Yeah, I love this one.
And I'm not really trying to pull her head off. It's just nice, soothing, relaxing stretch. And the longer that I hold this, the more she's going to relax. And I want her to focus on deep breathing in through your nose, out through your mouth. So smelling the roses, blowing out the candles. And as she relaxes and breathes, I can actually feel her head being able to elongate, pull out further and further. And that's telling me that those muscles are relaxing. So I want you guys to try these 3 things with any of your friends or spouse that has a headache. And then you guys let me know in the comments below how it works. You guys have a good rest of the day. And thank you, Vanessa.
Of course.